One day we see it, our first wrinkle, and then another. Well, we need to take care of the skin, but what some people don't realize is the muscles under the skin also provide that tone that reduces wrinkles. When we were young, we laughed, we cried, we had all these facial expressions. We chewed things like corn nuts, and we didn't mess with baby carrots. We ate the real big carrots. Look at the chewing muscle on this young woman, and look at this anguli oris. Okay, all those facial expressions help to make our faces muscular. Now, we didn't think about it at the time, but we had muscular faces. It's kind of hard to imagine. But look at this. This is maybe looks creepy to you, but as an anatomy professor, to me it's beautiful. I do work on people's faces, and when I do that, I get lots of Vaseline, and I pay attention to the muscle fibers. So here's the forehead coming from the supraocular ridge right here. I'm going to come up and around. I take my first couple knuckles. And this is something you can do. And those wavy lines on the forehead start to diminish. Now, it's not a magic bullet, right? It's not going to happen overnight. But when we massage and bring blood into these muscles, think about it. You go to the gym for your body, but when was the last time you worked your temporalis? Okay, I like to take 2 or 3 fingers, Vaseline, and pull it away from the eyes and up into the hairline. And I sometimes go into the hairline as well. I know it's a little messy to get Vaseline in there, but the scalp loves it. Chewing muscle. We need to chew. It's not just for muscle tone, but it loosens earwax. Chewing. A lot of people like to eat soft foods, but now and then we need to get something really tough and grind away at it. Unless you have TMJ or something. Buccinator. When you puff out your cheeks, this muscle goes into action. The platysma, this one I take fingers, and it's a large apron of muscle coming away from the oral region. And when I get to the end of the jaw, I'm going to keep going because here's the sternocleidomastoid. So that one goes all the way to the sternum, the front of the chest, past the clavicle. So here I come down and around, large strokes. I go deep on the sternocleido. It's a big muscle. It can handle it. It's the muscle that helps us to turn our head from side to side. It even elevates the chest, sternocleido. Here's a large muscle for the lower part of the face, depressor anguli oris. Now the reason I put these words here is so you can imagine, okay, depress means to bring down the angle of the mouth. And so there's angle of the mouth. This is where you get your, I use a second knuckle on this one. And I come down. And then just like before, when I get down to the jawline, I hit the platysma and I come back around here. You know what's wonderful? It almost feels like you're on a drug. Like when you're done, here's the small depressor labii. Labii means lip. I just do a quick pass with this one and a quick pass with the mentalis. I do pay attention to the muscle fibers. Now here's a big muscle. It's the kissing muscle, Orbicularis oris. Think about the first time you fell in love. You could kiss for hours, right? Or a trombone player that plays all night. Okay, I go in a circular movement. And I give this muscle some time, because what happens is we don't realize it during the day, but we have a stony face. Like someone cracks a joke, maybe we smile for a minute, but most of the time, and we grimace, which is the risorius, by the way. Kind of a strange word there, grimacing. We have a special muscle just for grimacing. But my point is, if we're stony-faced all day, then our cheekbone muscles, here's for smiling, zygomaticus major and minor, we're not working these muscles. And so one thing the massage does, I don't work the nasalis, but here it is. One benefit of working the muscles and massaging them is we start to realize that they are there. We start to say, oh, now I know what the orbicularis oculi feels like, the winking muscle. And by massaging it, there's awareness. And during the day, we might do some muscular toning actions. I always, when I get to the medial aspect of the orbicularis oculi, I back off because this is a fragile area, and I come back around. This is another large muscle. It's like the orbicularis oris, so I give it lots of time. And what you'll find is it's like when you're done, lots of Vaseline, you sit back and you cannot believe how wonderful your face feels. Levator labii, that's the lips, right? So this one comes up. I bring one knuckle right in there, and this one's worth doing because As this one diminishes, the muscle mass of the face, and sometimes you'll see someone who's very old, and the musculature right in here is essentially gone. And they're eating puddings and soft foods, so the masseter is gone, the anguli oris. And so let's work these muscles. Let's get our faces muscular once again.